So I would like to introduce Stacy Stanifer from University of Kentucky. Thank you.
Yeah, thank you. Hello, everybody, and thank you for having me virtually. I hope you all are doing well there. My name is Stacy Stanifer. I am a nurse, and I work at the University of Kentucky College of Nursing, and I'm really interested. So my whole career as a nurse has been in oncology nursing and taking care of cancer patients. And I really have a passion that's developed over the past few years, several years really, on cancer prevention. And so today I'm going to talk with you about our partnerships that we're really trying to grow within Kentucky to make radon mitigation affordable and accessible to everybody. So I'm here on behalf of a lot of people that are working towards this, but I did want to say that, and then also let you know just a few disclosures. So today I'm going to talk with you about several projects, and many of them, well, they're being supported through the Conference of Radiation Control Program Directors Radon Mini Grant. They're being supported by the National Institutes of Environmental Health Sciences, and they're also being supported in part by the Kentucky Radon Program. So put that out there. Thank you. Like I said, I've been an oncology nurse for many years, and in Kentucky, we really have a lung cancer problem. For many years, we have led the nation in the incidence and mortality from lung cancer. And a lot of that does have to do with our prevalence of smoking. So we've got about almost a quarter of our adults are smoking. And then many of our homes across the state lack smoke-free home rules, meaning that they allow for smoking to occur inside the home. So others in the home are exposed to secondhand smoke. And then additionally, many communities across Kentucky lack smoke-free ordinances. So people are exposed while they're out and about, maybe they're at work, they're exposed to secondhand smoke as well. And then in addition, according to the EPA, about 93% of Kentucky counties have moderate to high radon risk potential. And you all know that the co-exposures to both tobacco and radon really increases the risk of developing cancer. And so when we take that into consideration, Kentucky's high radon potential and the high smoking rates really creates that perfect storm for the overrepresentation of lung cancer. And so while we have a problem in Kentucky, we know that the disease really remains highly preventable. We did do a recent analysis and found that annually only about 13 out of every 10,000 homes in Kentucky tests for radon. And then we also found that counties with high prevalence of smoking had lower rates of home radon testing. And so, you know, those are a few issues. We don't have a lot of testing going on. And then those people that we would consider to be at high risk for that radon and tobacco synergism, we're not seeing testing going on there. And then lastly, mitigation rates in our state are unknown. So today I'm going to share with you some information on how the BREATHE team at the University of Kentucky is really working to grow access not only to affordable radon mitigation, but also home radon testing. So Radon in the Radar is a study that's taking place in Kentucky. We've selected 4 rural counties. So 2 are in the western part of the state. And these 2 have very high radon risk potential. And then we have 1 in the northeast and 1 in the south with lower radon risk potential. And all of the counties were matched on rurality, population size, and income. And then we recruited what we call citizen scientists in each of those 4 counties. And we have trained them to test their home for radon over a 2-week period using an Airthings Corentium home radon detector. And then they're providing us with their daily and long-term 2-week average radon values, as well as the weather conditions that are going on at the same time. In addition, these citizen scientists are also helping us to design a library lending program in their community, where we're going to place the Airthings detectors in the county libraries and make them available to library patrons. So our overall hypothesis or overall guess with this project is that by increasing knowledge on how the geologic and the atmospheric conditions can impact radon, partnering with these citizen scientists to use the air things detectors and then make sense of that data, then we can grow access to low-cost radon mitigation. We will reduce radon risk in Kentucky, and hopefully, in the end, our end game really is to reduce lung cancer. So what you're seeing here are the values that were collected. These are the 2-week average home radon values that were collected in those 4 counties during the fall of 2020 and winter of 2021. And you can see there's actually 26 out of 60. So 26 out of 60 homes, or 43% of these homes had values that were above the EPA's action level. And they range from 0.09 to 43.27 picocuries per liter. So we have quite a bit of people in just this sample of 60 that would be recommended to have their homes mitigated. As part of this study, one of the things that we've tried to do is identify radon mitigation companies who are going to serve these 4 rural counties in Kentucky. And so we developed sort of a vetting process for these for these 4 counties. What we wanted to do was identify mitigators that we would feel comfortable recommending, and have come into our own home if need be for radon mitigation. So we searched the NRPP website for a list of certified mitigation professionals in Kentucky. And then we assessed the Better Business Bureau ratings and accreditation. We looked through Angie's List ratings, and then we reached out to them and contacted the companies to confirm their certifications. And then we asked for customer references as well. And our goal was to identify 3 professionals who would service each of the 4 counties. But we really had a difficult time identifying someone willing to travel to 3 out of the 4 rural counties. And so we ended up having to look outside of Kentucky, and we ended up identifying another company in Tennessee and one in Indiana. But I tell you all of this really just to highlight how these rural areas of our state really had some challenges with just getting access to a certified radon mitigator. I should also let you know that as part of this study, our citizen scientists, if their home tested at or above 4.0 picocuries per liter, we offered them a voucher so they could have 30% off the cost of mitigation up to $600 when using one of these study-approved radon mitigators. So some of the barriers that we identified to mitigation, and some of these are already known based on other research, but when someone isn't able to reduce their exposure to radon, whether it be because of lack of access or finances, this really creates a health equity issue. So in our state, in Kentucky, about 49% of our counties are considered rural. So a lot of our state really has a lack of access issue. When I looked up the certified radon mitigators, there are 47 on the NRPP website for Kentucky, but 64% of those are located in either Lexington or Louisville, which are really more of our metropolitan areas in our state. But you can kind of see that on the map there, all of that purple is rural. In addition, knowledge is definitely a barrier to mitigation. A lot of people didn't quite understand when we did our training with the citizen scientists about radon testing and mitigation. We had a lot of questions about mitigation, on how it really worked, and just the benefits of it. And then lastly, the cost. So despite giving them the voucher for 30% off cost up to $600, coming up with the other 70% has proven to be a real challenge for some of our participants. And so we're trying to really tackle that through this project. So one of the things that we did was I did apply for a small grant from the Conference of Radiation Control Program Directors. We had, like I said, we had difficulty identifying radon mitigators, in 3 of the 4 counties. So what we tried to do was recruit a professional who is in a similar business like HVAC, home remodeling or construction that might be interested in expanding their business model to include radon measurement and mitigation. So we focused our recruitment efforts in Christian, Logan, and Rowan County. Those were the counties that we were having trouble identifying 3. And we felt like recruiting somebody that already lived and worked within those communities and had an established business would really help the economy of the rural Kentucky, but also they may already have resources available, perhaps have knowledge of loans and things that would be available to these residents. So we developed a plan for advertising. We contacted community and technical college, libraries, Chamber of Commerce, area development districts, union offices, cooperative extension offices, Habitat for Humanity, anybody we could think of that might have access to these kind of professionals. And we shared this flyer with them and asked them to spread it around. We ended up contacting, let me go back. We ended up contacting 15 organizations, and I only had four individuals contact me about inquiries about this potential opportunity. And some of the barriers that I heard from people, from these professionals, is they were just really concerned because people around those areas, this is a quote, people here don't talk about radon. And so they were concerned about just the amount of time and investment into the company when there wasn't much home radon testing going on in the area. But we did end up selecting someone who in Logan County, they were owner of a home remodeling and roofing business, and they also worked as a home inspector. And then another gentleman owned a construction company, and he recruited his son, who was one of his employees, for this opportunity. And so both of them ended up being recruited by word of mouth through some of our Radon on the Radar community organization partners. For this project, we did run into some barriers that were really unfortunate. So by the time we were able to recruit them, the virtual training platform that we had planned to use, we were advised it was going to be revised because of the new certification exams. And so we delayed the training just a little bit to allow for them to have the maximum amount of time to take part in that online training. And then that training ended up, or the revision took longer than had planned, and their training ended up being delayed, so that by the time the grant funding was over, these 2 individuals really didn't have the time for their professional development. And another issue that we think took place was there was really a boom in demand for home remodeling and construction during the COVID-19 pandemic this past year, and that also led to their lack of time for professional development. And so unfortunately, these 2 gentlemen were not able to be trained like we had hoped for. They both were willing, if with more time, they would be willing to continue down this endeavor, but they weren't able to at this time. One of the facilitators, though, was at least talking with them, is they recognize the lack of access to mitigation in rural Kentucky and feel like it would have been a really important thing for them to take on for their community. So identifying sources of mitigation assistance in Kentucky with health equity, that means that everyone has a fair and just opportunity to be healthier. And so we started out really as a nurse. I don't know anything about these finances and financing this sort of work. And so it came about just through like word of mouth and snowballing. So talking to someone and then them suggesting another organization and asking them to connect us. But we've really been able to talk with many organizations throughout the state of Kentucky to try to identify radon mitigation. One of the largest funders in Kentucky is the Kentucky Housing Corporation. So they have what's called the Affordable Housing Trust fund repair program. So organizations in Kentucky actually submit applications for funding to them, and then they loan out the money. So 40% of all funds received are to be used for rural areas of Kentucky. So that was a plus for us. And then it's income based, and there is a max of $15,000 per project. So some of the organizations that we've found that have received funding from the Kentucky Housing Corporation is Frontier Housing. This is located in Rowan County, Kentucky, and they service the Northeast region. They also have some access to other available loans, which is also a plus for these participants. Habitat for Humanity was willing, and then Hopkinsville Community Development Services as well. The Kentucky Housing Corporation, the first thing we heard when we talked to them was they were really interested in RADON. They said it was kind of the buzz all around the country is what they're hearing. So that was kind of a plus, and they were willing to, they felt like RADON was a health and safety hazard. So they were willing to allow for their funds to be used for RADON mitigation. There was a stipulation, so RADON itself would not be, when they release these funds, RADON itself would not be the only home improvement that they would make, but they would have to go to the home, and whatever other home improvements that house was in need of, they would do at the same time. So to bring it up to some health and safety standards that they have. Another resource for at least our study participants was the health department in Rowan County was willing to partner with us. So we only had 2 participants in Rowan County that had elevated radon, and we worked with them. They were willing, and they got approval to use some of their funds for their radon program to assist these 2 participants with radon mitigation should they choose to do that. They decided they would match our 30% up to $600. And there is an education component that'll go along with that should those participants decide to mitigate their home. And then the other opportunity that we identified was through the USDA Office of Rural Development. So they have the 504 home repair program. And this provides loans to very low income homeowners to repair, improve, or modernize their home. And it also provides grants to elderly, very low income homeowners to remove health and safety hazards. So again, we heard that word again while we were talking with them, but this seems to be, at least because so much of our state is rural, this seems to be a really promising opportunity for us. And you can see there the eligibility criteria, and then how much money is available through their loan and their grant program. So some of the lessons learned, I know I've gone through that really quickly, but really need for increased radon awareness, and we're hoping our Radon on the Radar study we'll do that in our state. Our partnerships have been really key to getting the word out and spreading the word and just connecting us with others across the state. Those working in the affordable housing space really do prioritize the creation of safe housing, and they recognize radon to be a health hazard, and they all have been really willing to address that with us. And then we also need to continue to address lack of radon mitigators in rural Kentucky, and we'll keep using our thinking caps to try to achieve that. And then lastly, based on these conversations that we've had with people across the state, we're in the process of creating a resource list for radar participants and for these county libraries, because we're getting ready to launch that library loan program. And we know there's going to be a great deal more people that are in need of mitigation and potentially unavailable to afford that. And so having this list of available financial resources for them will be really important as we move forward. Be happy to entertain any questions you guys might have.
Terrific. Thank you very much, Dr. Stanifer. Is there anybody that does have a question for her? Stacy, I'm from Ohio, so a lot of what you gave us statistically in Southern Ohio fits very well with what you guys put up with there.
Yeah, I'm from Ohio as well. Thank you.
I thank you again.
Yeah.
Have a great day, and we appreciated your time.
All right. Thanks, everybody. Take care.
All righty. Oh, you had a question for her? Stacy, are you still there?
Yeah.
Good. Go.
We're talking to here.
Should be hot.
Well, thank you very much for your efforts on this. This is exactly what the industry needs. My question is, I live in a low-income town in north central Massachusetts that could probably use an air thing in the library too, to test these homes. Has any other states or anybody from any other states contacted you to duplicate your efforts?
So not yet. We have heard of an investigator in Canada who actually, I believe they were in Nova Scotia, did this very similar thing where they put the air things detectors in their library. So we've talked with her once, but in the United States, we don't know of anybody else doing that, and nobody's reached out to us either.
Because it's very common for me to run into jobs where neighbors lend their monitors to, their neighbors to test their house too.
Yeah.
And maybe you should come up with like a moderate mitigators without borders program or something.
Excellent idea.
Yeah, that would be great.
Well,
Thank
listen,
you.
Stacy's contact information is in the app. So if you have a state contact that you think might be helpful, I'm sure Stacy would be really glad to
Yes.
communicate at least briefly with them to get them on target.
Yes, that would be great. Thank you so much.
Stacy, again, thank you.
Yeah, take care, everybody.
Good day.